In addition to the impaired bicarbonate reabsorption, which of the following electrolyte abnormalities is commonly seen in proximal RTA? Okay, so we have hyperkalemia, hypokalemia, hypercalcemia, hyponatremia, and hyperphosphatemia. Okay, a 30-year-old man is diagnosed with proximal RTA after presenting with generalized weakness, polyuria, and polydipsia. In addition to the impaired bicarbonate reabsorption, which of the following abnormalities is commonly seen in proximal RTA? Okay, for me, my gut answer is hypokalemia. Oh wait, let me actually think about this impaired bicarbonate reabsorption. Um, no, that would lead to an acidosis. So that would not be hypokalemia. Um, I would say actually. Oh, sorry. Let me go through the list. Okay, so it's case imaging. There's no imaging in the labs. My gut actually. I'm trying to think.
All right, so this is where I'm gonna kind of butt in a little bit here,
Okay.
right? So one of the things of test taking strategy, okay, you're gonna get questions like this where it's just like, you would agree with me, do you know or do you don't, right?
Hmm.
Um, I guess my question to you is, if it's a you know or you don't, right? Do you want to spend a lot of time on it? That's
I'm
the test taking
yeah.
question for you.
Well, I mean, like you said, like if I don't know it, there's no point. I mean, that
Exactly.
sounds bad, but like, yeah, there's no point. Like, just wasting time trying to conjure an answer.
Exactly. So my thing is always, when you're test taking, this is obviously, of course, if you're like, if you just need a little bit time to think and say, oh, it's somewhere back there, just give me some time to think, then of course, think through this, right? But me in particular, as someone tutoring you, right? In my mind, I'm like, I don't remember this, right? Me personally, right? I was like, I don't remember this. So how I would take this question, and I'd be like, well, you have five answer choices. You have a 20% of getting it right, right? And you pick an answer, and then you learn from it, right? So that's going to be sometimes when you take these kind of practice questions and whatnot. That's how I want you to kind of see it. Sometimes students get caught up on saying, you sit here for 15 minutes thinking about this question, but really, does that change what you remember or not? Probably not, right? I would say the majority of the time. So, if you get stuck, you go, okay, well, this is something that I got to learn, and you got to kind of move on.
So, yeah, I mean, if I just had to pick one, I'd pick hyperkalemia.
Okay, perfect. Okay, and then
But
also
yeah.
on, yeah, also on top of that, I would say, a good feature too that you can utilize too, if you get these questions while doing MD Boost questions, we have a hint function here. That's a little light bulb here. It can kind of get your guessing game down a little bit more, but like at the end of the day, right, it's all about learning. It's not about getting questions right or wrong.
Okay.
So these are kind of the two. Let's kind of see, right? So let's look at our explanation here. Correct answer is hypokalemia. So proximal renal tubular acidosis, type 2 RTA, impaired bicarb in the proximal tube of the kidney leads to bicarb wasting and decreased bicarb levels. And then you get non-anion gap metabolic acidosis. And just kind of on a learning point here, non-anion gap metabolic acidosis, because you're only losing bicarb, you're not creating any kind of other things that are besides the bicarbon hydrogen kind of acidosis kind of metabolism. And then hypokalemia, electrolyte abnormalities in proximal due to decreased or increased distal sodium delivery, which enhances potassium secretion in the distal nephron.
Okay. Okay. Yeah.
Okay, so you keep it simple like that. I would say, like I said, I've tutored for years and years and years, but even these things, if I don't review for I haven't seen a RTA question probably in a while. So, you forget some of these things sometimes, which is completely fine. You just have to refresh it, kind of understand it, and then kind of move on. So you make your time of studying efficient.